In today's morning rounds, doctors have long warned about the growth of antibiotic-resistant germs. A new report from the CDC says we may face catastrophic consequences if we don't act to control the superbugs. Dr. Holly Phillips is with us. Good morning.
Good morning.
So how alarming is this report?
You know, this is very alarming, shocking really, but I think that was deliberate. I believe that the CDC wanted to send a powerful message, and hence they released these numbers. Now, you know, we've heard about superbugs in the past. These are bacteria that are resistant to all the antibiotics we have available. Now, for the first time, the CDC is putting numbers on the problem. They say 2 million Americans get sick with superbugs every year, and 23,000 die. Now, that's more than the numbers we see with the flu.
They want to shock because they want to produce what kind of reaction?
You know, I think they want to mobilize us into action, both in the medical community as well as patients themselves. Really, this all happens because we use antibiotics too much, both in medicine and in agriculture. 80% of the antibiotics that are used in our country actually are involved in farming and livestock. But really, in medicine, we are using them too much. Some estimates say 50% of all antibiotics that are prescribed shouldn't be or are used inappropriately. So we all need to scale back.
Whose fault do you think that is, that there is an overprescribing of antibiotics? Is it the doctors?
You know, I think it's a mix. I do think doctors want to treat patients appropriately and make sure that you're not going to miss something.
And patients don't want to hear from a doctor, actually, you're going to be fine in 3 days. I know you feel bad, but you got to just wait it out.
That's so right, Nora. When I tell patients that, when I say fluids, rest, call me in a couple of days, that's not what they're there to hear.
They want a pill.
They do want a pill, and there is a placebo effect with antibiotics where you give them the antibiotic and they start to feel better right away before they've even taken the pill.
And then just give them a placebo.
Exactly.
And I think the problem is, too, most people have a cold virus, and the antibiotic's not going to do anything to cure a virus. They only help bacterial infections.
Exactly. You know, one of the bacteria that the CDC listed as most urgent is called CRE. Now, that includes a group of bacteria. E. coli is one. We've heard of that. Salmonella, Shigella. And these bacteria are spreading in hospitals. They are really a red alert because they're resistant to every antibiotic we have on the market. There will come a time when we reach into our big arsenal of drugs for somebody who's very sick, and we will not be able to help them. I think that's why the CDC really wanted to get this message out there.
Bottom line, less antibiotics. Dr. Holly Phillips,
Absolutely.
thank you.